We have Dr. Dennis Sakala, who is an orthopedic surgeon, and they deal with things like fractures, that's broken bones, dislocations, arthritis, or osteoporosis, yeah, that's the word, and then sports injuries, back pain, and other conditions, and the treatment of them as well. And he's in the studio today, so if you have issues or you want to ask any questions, you can give us a call on 0212617140. But while we were on the break, we started talking about the effects of smoking on bone repairing. I mean, I think we need to emphasize that, especially that a lot of people are finding it hard to stop smoking.
Yeah. So I generally agree, and thanks for raising that up, because it's becoming more of a problem nowadays. One of the things I think we were discussing as the ad was playing is the fact that smoking does have deleterious effects on the skeleton. And what tends to happen, especially those that might suffer broken bones, and they need those bones to heal, particularly, say, for instance, like on the spine or the leg bone, you tend to find that those that smoke a lot have a tougher time healing in terms of the bones. Yeah, so you find that the bones actually, in most cases, more often than not, fail to connect as a result of smoking. And as a rule, for those of us that tend to work on bones and operate and all that, we like to advise our clients to say, okay, look, prior to the surgery, we like that just, if you could stop smoking. Why is that the case? Because most of the time, some of the substances that are contained in cigarettes, say for instance nicotine, it tends to kill the cells that help bones regenerate. Those cells are called osteoblasts. So those chemicals are toxic to those cells. And so when the bones heal, or rather when the bones break, they need to heal, they need to connect. And those cells are pretty much can be likened to bricklayers. Yeah, imagine you're building a house, right? For you to actually your house to be built,
you need
bricklayers, materials, and all those things.
Yeah.
Now imagine you're always insulting your bricklayers, you're always sort of beating them up and all that. Your house is never going to finish.
Yeah.
Now, when you look at the bone, a similar thing happens. Like those bricklayers, as far as bone repair is concerned, when you're always constantly smoking, it's as good as you sort of being ill-treating your bricklayers. Your bones will never heal. And so, as a rule, we like to say, okay, look, if you could actually stop smoking, it actually works best for you. And you find that time to healing, when it comes to some people who do not smoke compared to those who smoke, those that do not smoke, bones heal much faster. Yeah, and so that's not Dr. Sakala sort of myth and all that. It's actually proven, it's researched. Anyone can Google it and they'll find that actually, that's the reality.
We usually celebrate. I don't know if it's the word celebrate, but we talk about sickle cell a lot on this show, at least like 3 times a year. And some of our sickle cell sufferers have indicated that they have bone problems. One of them is Nene. She had to have a hip replacement, and we talked about it. What is the correlation between sickle cell and bones?
Okay, so sickle cell generally is a genetic condition, meaning that you're born with it.
Yes.
Yeah, and what tends to happen is the problem, of course, is at the level of the DNA, but then as it relates to the manufacturing of the red blood cells, yeah, the part of DNA that carries instructions for making red blood cells, particularly a protein called hemoglobin, which is contained in the red blood cell, the protein which actually carries oxygen. Yeah, and so you find as you breathe in and breathe out, as you breathe in, the 21% oxygen that's in the air has to be received, okay, in the body. And the chemical that receives that, oxygen is hemoglobin. Yeah, now, if there's a mistake in the manufacturing of that protein does not behave the way it's supposed to. When the oxygen supply is low, or when there's an infection in the body, or maybe there's inadequate water content in the body, what happens is that hemoglobin tends to take on a shape that changes the red cell from being circular to being like moon shape, like half moon shape, like a sickle. Yeah, and hence the name sickle cell. Yeah. Now, as a result, what tends to happen is that these cells, as they move, they also have a tendency to clump together, block small tubes, like small blood vessels. And naturally you find the small blood vessels in areas like, in the hands, the feet, and different parts of the body, in the brain. Yeah. And so when this happens, it's an occlusion. It causes an occlusion in the blood vessel. And when there's an occlusion, imagine, the body depends on oxygen 100% of the time, isn't it? Now, if that oxygen, which is being carried by the blood, is not delivered to a certain site because there's an occlusion, you end up with a crisis. Because further downstream to where the oxygen is supposed to be delivered, what happens is things begin to die. So if it's in the brain, you find someone has sickle cell stroke. If it's in the bone, you find someone develops what is known as avascular necrosis or death of the bone, and particularly in the hips, in people with sickle cell,
yes.
And others manifest with all sorts of things, including pain, and the crisis, the full term of the crisis called the VOC, or vaso-occlusive crisis, meaning there's a blood vessel more or less like closure. And so if it if the vaso-occlusive crisis happens in the bone dies. Someone who essentially will be needing, very likely in no time, will be needing a bone replacement, a hip replacement. Yeah, but then others come down with infections. In fact, sicklers tend to come down with massive infections, quite some bad infections, as a result of sickle cell disease. And so you realize that there's so many other conditions, as they relate to orthopedics and sickle cell disease.
You are a surgeon. That means you perform surgery.
Yes.
Yeah. So, is there any way to remedy bones without going through surgery?
It depends on the condition. It depends on the condition. So, starting from sickle cell itself, is pretty much having adequate sleep, adequate hydration, preventing the crisis, so to speak. Is the way to go. And there are medications that we put people on called the hydroxyurea, because of course sickle cell disease is not managed primarily by orthopedic surgery. It's managed by hematologists or blood specialists. When I see a sickler, it means something has gone wrong, and then I have to do surgery. As you indicate, I'm a surgeon, so it means that I have to manage the complications of something having gone wrong. Yeah.
Okay.
So meaning that we have to prevent it, and some of the preventions is what I've just talked about. And generally, I see a lot of accident victims, road accident victims, pedestrians, and all those things.
We were talking about bikes just early on. Motorbikes are causing a lot of accidents. Yes.
Exactly. So road safety, I think observing road safety, we see people sort of zipping around on motorcycles, and half the time, in fact, is it 70-80% of the time they have no headgear.
99% of the time they have no headgear.
Yeah.
I was being conservative. No headgear. And you wonder, and you see them sort of flying around at high speeds. And you start wondering, like, if this guy falls. So to answer the question, pretty much is observing road safety sort of tips, headgear all the time, observing traffic rules, because it doesn't mean that when you're on a motorcycle you are immune to injury. In fact, most of the injuries I know, like in places like the Eastern Province, where we have a plethora of motorcycles.
Yes.
Yeah, there's a lot of injuries there. And invariably, most of those will be orthopedic in nature, meaning involving bone injuries. Yeah, of course, there's neuro, like head injuries also, but more, a lot of them will also have orthopedic trauma. So observing rules, I think.
I mean, there's replacements of bones. Sorry, Dikasi.
Yeah.
Yes,
There's
okay.
replacements of bones. How many bones can you replace in your body? I know there's hip replacement. I've heard about that.
Yes.
I mean, can you replace every bone in your body? Or there's some bones you can't?
You pretty much can replace a lot of bones. Yeah.
With what material, though?
There are different types of material, materials rather. But then these materials must be, as a rule, they must be inert, meaning that when these materials are in the body must not react to their presence. The body has the immune system, isn't it? Yeah, and the immune system is programmed in a way that it's meant to, to identify what's coming, and to either sort of just, ignore it or attack. Yeah, and that is why you find that whenever there's materials that are being designed for use in the body, it's those that are deemed inert. They will not trigger an immune response, and so we use a lot of metals. Like historically, we've used stainless steel, but it's not just the ordinary stainless steel. The stainless steel is coded, and this particular stainless steel is called 316L or 316L. Yeah, there are different types. There's 314, but for medical grade stainless steel, we start from 316L. And then there's other sort of metals that are used, like titanium. Nowadays, we're using a lot of titanium because of its behavior.
Sounds expensive.
And it is expensive. It is expensive, but then it's MR compatible. Like, should you need an MRI scan, for any other reason?
It's not magnetic?
No, it's not ferromagnetic. No.
Okay.
But stainless steel is ferromagnetic. Yeah.
Okay.
And so, so generally, these are some of the materials and we use alloys of cobalt and all these things. Yeah. Especially when you're doing things like using prostheses like hip replacements, knee replacements. Yeah. So generally, that's what we tend to use. And of course, but of course, I know we're not talking about material. Sorry, you have to stop me. I get carried away.
Yeah. I was just about to. I was winking to Ndekazi, go ahead, Ndekazi.
You mentioned something earlier.
Yeah.
You said that it's quite hard for the bones in our feet to heal. Which part of your bones should are most dangerous? The ones that this, like, for instance, I've heard that once you break your spine, it triggers a lot of reaction, like practically the whole body is paralyzed. Which part of your bones is a no-go area? Like you really need to look out for.
Safeguard it.
Yeah, safeguard it with your life.
All the bones. All the bones, pretty much.
Okay.
We must. But then I think, of course, the feet, they heal well, but it's the leg bone between the knee and ankle.
Okay.
That tends to present a bit of a problem, especially the lower part.
Okay.
Healing is a bit of a
The
challenge.
shin?
The shin, yes, the shin bone.
Okay.
Yeah, that one is really very, very difficult. Yeah. That's very, very difficult.
Because people limp forever.
Yes, especially if it's not treated correctly, or lifestyle, as we had alluded to, is not taken care of. Other bones, the hip bone. Yeah, the hip bone. There's a part of the hip bone we call the neck. Yeah, so if someone sustains an injury there, the risk of that bone healing or failing to heal is quite high.
Okay.
Other bones include, there's a certain wrist bone, in the wrist called the scaphoid. It's closer on to the thumb. Yeah, so also that bone, once it breaks, it must be taken care of very well. Like if it's displaced, it must be put back in position in good amount of time and compressed. And then in the spine, the second bone in the spine, in the neck, there's a projection it has, we call the dens. Dens means tooth. Yeah, so it's got a projection that goes up. So if it breaks and it's completely displaced, not taken care of, usually there's a risk of it not healing. Okay. And in the foot, there's a bone we call the talus. It's the one that connects the leg bone to the foot. So that bone also, due to these bones, why they present a challenge in terms of healing is due to blood supply. Blood is life. Yeah. So bones that have very good blood supply heal well, and bones that have poor blood supply tend to struggle to heal.
All right.
And the bones I've talked about tend to do that.
We've got like 8 minutes. I think we can get some calls and some text messages as well. It's 0212617140, and let's see if we can get your calls. Doctor, I think your phone, somebody's calling you right now.
Yes, I need to.
No, somebody's calling your phone.
My phone?
Yes. Whose phone is that?
Not mine.
Not mine either. All right, anyway, it's 0212617140. Let's see if we can pick up a call.
Yes, we should take.
Are we good with the call?
Yeah, let's get a call. Hello?
Hello, mabombe basibu levantikazi baisasaka lawa
Twawomba vya bwino.
chawa machida kesa chabombe ndipo kupsa in terms of the dislocations and the fractures. Pakuti muntu adikaze ame ntido di ipitapo pakuti muntu achikeri recover. Ela chimita pakuti pari medication ya sequoia other medication. Thank you, Mombe.
Just repeat your question, Bachiru Duncan. I think he's gone. All right, let's go to the text messages.
Okay, good morning. I used to have dislocations in my shoulder in my 30s. It stopped in my 40s, but now I feel like it's coming back. I'm 53 years old. What causes this problem? I'm Barbara.
Okay, so generally, I'll start from the definition of what a dislocation is. A dislocation is a situation where you have two or more bones meeting in a place called a joint. Yeah, and then they move out of their natural position for a number of reasons. So that would be deemed a dislocation. Now, in this particular case, the text message refers to the fact that this relates to the shoulder joint. Yeah, the shoulder joint is a joint that is at high risk in terms of dislocations. People tend to dislocate for a number of reasons. Yeah, but then as a rule, those that tend to have dislocations less below the earlier than 20 years have a high risk of having recurrent dislocations as opposed to those that have it later. But of course, it can happen. Like we can have modifications to that rule. Yeah, and then what she's complaining about is there's a feeling of instability as though it will dislocate.
Yes.
Yeah. And so, it means she will need to be seen, just to assess the level of instability there is in the shoulder. And maybe she just needs some physiotherapy to strengthen the muscles around the shoulder.
Let's get some calls. 0212617140. Good morning. Oh, I missed that. 0212617140. That's the number that you're giving us a call on. And unless you have any more text messages.
No, a question though.
Let's get a call.
Okay, let's get a call.
Good morning.
Good morning, Mr. Steve.
Yes, who are we talking to?
Brad.
Go ahead.
Yeah, so Mr. Steve, I wanted to ask a joke. So I'm an athlete. So what happens is every week I do a full marathon run just for basically training. So ngeibating na donsa ngana skapa 21 k's when I'm approaching the half marathon. Left knee and irambo kalipa. But ukunish wachidai sore utuka fe wino. And after 21 kilometers ukiyo kunish ni ambo kalipa. Then you right and I have a win. So I don't know how the doc can advise on that one.
Thank you.
Thank you.
Yeah. To a total at one. Okay. Yeah, to a total, I think your question is important. So
especially that there are a lot of marathons.
There are a lot of marathons coming up, yeah. So kwa question ni ipsho yenu ilafika mwamono so that twice bwafya bule ichidelenga ikufi imo ile kalipanga mafika pa 21 km mark but imbita ile kalipa why because bambi kwa what maybe ikufi ya ku right na nguya ku left na ipusana ko na imbi in terms of design of yava and then na kuli amepsho yambyo ningafo kwipsa insapato bafwala pako butukasha musango shani ko bare butukira ni kwisa and then ilafaika kwishba like bala chitama stretch before running fionse fira chita mata and then of course yashina but ilafaika mwamonwa it's important so ati to understand nangu ni motoka mukasanga timotoka nga mulensha bambekanda no itera ku left lapo wangu kuchira yakura right and you find that maybe it's just because one side the alignment is off a little bit, maybe it's got a toe out, a toe in, and so you cannot essentially arrive at a diagnosis without doing due diligence.
Seeing somebody.
Yeah. So I think it's important that you say.
All right, and speaking about seeing people, I mean, the City Clinic is, doing this. Tell us more about what City Clinic is talking about, and what you're doing this week.
Okay, so in 2 days' time at the clinic.
Wednesday,
that's the 24th. Yes.
23rd.
23rd. Sorry, sorry, that's on Thursday. So 24th.
24th.
Sorry.
Okay.
Yeah, 24th. Yeah. On the 24th, City Specialist Clinic, a clinic based here in Ndola, at Zimat Kansenshi Mall. Zimat is Kansenshi Mall. That's opposite Premium Plaza. The clinic is located just next to Angelina's Italian restaurant. So what? It's a multi-specialty clinic. We have different specialists. For me, I'm an orthopedic surgeon, and what we're doing on the 24th is we're hosting a visiting spine surgeon. So the spine surgeon that will be coming and we'll be looking at a number of spine conditions. Of course, there are people with low back pain. Low back pain is very common, especially people who sit for a long time driving, prolonged driving. And people essentially get exposed to equipment that vibrate, like mine workers and things like that. People who are weightlifters, people who lift weights. People that are endowed in terms of weight, obesity, so to speak. People who smoke. All those I've talked about are risk factors.
Or women with big breasts as well.
Yes.
I've heard stories.
Yeah.
No, I've also heard stories. Really, I have.
Yeah.
Exactly. So, any of those people, or anyone with back pain, is welcome to come, and then the spine surgeon can, particularly difficult back pain, including occupational, as I've already alluded to, like work-related back pain. They're happy. They'll be welcome to come, and the visiting spine surgeon will see them. Back pain is underrated, and if I may just do a little bit of education here. Like the commonest cause of someone visiting a doctor's office is a flu, respiratory tract infections, world over. And back pain is number 2.
Really?
Yes, back pain is it's very, very common. Yeah, in fact, publications have indicated, places like the US, there's been talk of spending over $100 billion just on back pain. And it's one of the commonest cause of absenteeism from work. Work dissatisfaction. So it's something that is a very subject of importance. And so we thought at City Specialist Clinic here in Indola at Zimat Kansenshi Mall, we need to make time for those that would have
When does it start on Thursday?
So we're starting, essentially we're taking the bookings on now. The spine surgeon is arriving on the same day. So we're starting 12 hours. And then going into the second day, and should there be need for procedures, the procedures that will be advised.
All right.
Yeah.
Sounds great, but we got to go. It's 9 in the morning. Hey, Dr. Dennis Sakala, thank you very much for joining us on the show and, educating us a lot about our bones. I don't think we talk about our bones as much as we need to. Yeah. Thanks for joining us, and make a date with City Clinic on Thursday as they check out your back pain. Yeah, we got to go. Thanks for joining us on the Sunup Breakfast Show. We out of here.
Breakfast.
The news headlines brought to you by Trade Kings. Now, boom.
My name is Ndekazi Lungu. The Zambia Flying Doctor Service, ZFDS, has made remarkable strides in rural healthcare delivery with the transfer